Well, most of you know this. It's open enrollment season for a lot of companies for health insurance. And if you are looking at the fine print, you might get some sticker shock with the premium prices. Well, it's not just you. A new survey from health policy think tank KFF says yearly premiums for a family have jumped 7%, and they've jumped for individuals too. That 7% translates to an extra $75 to $500 out of pocket, so a decent amount of money. And in October, we often hear conversations about health, and specifically breast health, breast cancer. This month, you see pink in a lot of different places. Doctors say you should get a mammogram every 2 years after you turn 50 because age, that's one of the biggest risk factors. But there's a dozen more risk factors, from family history to how much activity you get. And the CDC says some women will get breast cancer without any risk factors at all. So just because you should get these screenings frequently doesn't always mean that's easy to do. But in the Twin Cities, One Health System is putting the screening equipment on the road, bringing them on trucks to neighborhoods that need them. Here's Kaya.
An M Health Fairview clinic in Phelan Village, St. Paul.
It's a good clinic. They care. They really care.
Lorraine Cooper's been coming here for several years now, and while she raves about it,
But I wouldn't go nowhere else. I like the people here.
this day-to-day doctor's office doesn't offer breast cancer screenings. So last year, the healthcare system started using trucks to change that and bring mammogram services here.
Into the community.
Senior manager Chelsea McGuire grew up in the historically underserved neighborhood and says the initiative is meant to reduce disparities for BIPOC patients.
We know that if you don't have to travel far and if you don't have to make another trip somewhere else, you're more likely to be successful in making that appointment and getting that service done.
Morning. Appointments are required. The exam takes about 15 minutes.
We have language services here as well. So sometimes when we have patients, especially who are non-English speaking, we do require that interpreter to be here and be able to help through that entire appointment. By the end of this week, we should have most of those results back.
And there are 2 more of these trucks that go around to M Health Fairview clinics that otherwise don't have mammograms on site.
M Health Fairview reports more than 60 women of color have been screened for breast cancer because of the trucks. This is the 3rd time one has pulled up here.
We don't ever want to hear that there is something that we need to have a conversation, but because a patient was screened at our site, we were able to go forward with a diagnostic screen.
As for Lorraine,
She was very professional. She know what she's doing.
she'd been screened elsewhere, but this was her first mammogram here.
We're black, and we're known to have high blood pressure, cancer, diabetes, strokes. You know, we black women, we can have anything going on in our body. We are the ones that carry stuff and never know about it. That's why you need to have yourself checked, down there and up here. Just because it don't hurt don't mean it ain't there.
She should be the spokesperson for screenings. That's pretty awesome. And like we mentioned, October is Breast Cancer Awareness Month. But did you know that National Mammography Day is every 3rd Friday in October? And that's just a couple of days. So there's your reminder to schedule that mammogram.